Look at your ankles right now. Press your thumb against the skin just above the ankle and hold it there for a few seconds. Then release. Does the mark disappear immediately? Or does it stay there, pressed into the skin, like the tissue has no intention of bouncing back? Now think about yesterday evening. Did your shoes feel tight after midday? Did your socks leave deep marks on your legs, even though they were the same socks you always wear? And at night, how many times did you get up to use the bathroom before dawn? If any of that sounds familiar, there is something you need to hear today. Maybe you have already been to the doctor with these complaints. The cardiologist ordered an echocardiogram, evaluated your heart function carefully, and told you everything looks fine, normal, no signs of heart failure, no apparent reason for concern, and yet your ankles keep swelling every single day, with a regularity that is starting to feel inevitable. That creates a quiet confusion that is far more common than most people realize. If the heart is fine, then what is happening? Is it something more serious that the tests missed? Is it simply age? Before we go any further, if this kind of content makes sense to you, subscribe to the channel. Every week there is something new here that can change the way you understand your own body. What you are going to discover today is that there is a mechanism inside your legs that ages silently, that heart tests simply cannot measure, and that may be responsible for much of the swelling, the heaviness, and even the trips to the bathroom in the middle of the night. A mechanism that almost nobody explains clearly, and that, once you understand it, will make immediate sense. Stay until the end, because in the final minutes of this video, you are going to learn a simple 7-minute protocol that can start changing this picture as early as this week. There is a very widespread belief that swollen ankles in older adults are almost always a sign of a heart problem. And that belief is not entirely wrong, because the heart can indeed be involved in some cases. But it is far from telling the complete story. The truth is that the vast majority of chronic leg swelling in people over 60 does not come from the heart. It comes from the legs, from the venous return system, from a set of structures that work silently every single day to push blood back upward, and that over time begin losing efficiency in a way that is gradual and nearly imperceptible. Think for a moment about how circulation works. The heart pumps blood downward with force. It sends blood through the large vessels, down through the limbs, irrigating tissues, delivering oxygen and nutrients to every cell in the legs and feet. That part the heart does well, even as we age. The problem is on the way back, because the blood needs to travel back up to the heart, and traveling upward against gravity, from the feet to the chest, is not a simple task. There is no central pump handling that return with the same power the heart uses to push blood downward. For that return to happen, the body depends on a distributed system, with several components working together. And one of the most important of those components is right here, in the calf. The calf works like a second pump. When you walk, climb a step, or move around, the calf muscles contract with force. That contraction squeezes the deep veins inside the muscle, pushes blood upward, and tiny venous valves close behind the flow to prevent it from falling back down. It is an elegant system, efficient, and entirely dependent on movement. Imagine trying to pump water upward through a vertical hose using a sequence of valves and a pump that contracts with every step. When the pump works well and the valves close precisely, the water rises without difficulty. But when the pump starts losing strength and the valves no longer close completely, the water does not rise as efficiently. Part of the flow stalls, part falls back down, and pressure begins to build at the lowest point of the hose. That is exactly what happens in the legs. After 60, 3 silent changes take hold together. The first is the gradual loss of muscle mass in the calf, a natural part of aging that reduces the pump's contractile force. The second is a decrease in daily mobility, because many people spend more and more hours sitting, and when there is no movement, there is no muscle contraction, and the pump simply stops working. The third is the weakening of the venous valves, structures that wear down over time and begin closing incompletely, allowing blood to reflux slightly with every pause between contractions. All 3 together create the perfect environment for blood and fluid to pool in the legs. The pressure inside the veins increases, and when venous pressure rises beyond a certain point, fluid begins leaking from the vessels into the surrounding tissue, into the subcutaneous layer, into the ankles, into the feet. And the heart tests continue to come back normal, because the heart is not the problem. There is a clinical term for this set of changes: chronic venous insufficiency, one of the most common causes of leg edema in people over 50, and one that is frequently underexplained in medical appointments. The natural focus when an older patient presents with leg swelling is first to rule out the more dangerous causes, like heart failure, kidney disease, or blood clots. Once those are ruled out, venous insufficiency often ends up in the background without a clear explanation of what it actually means in practice. And that is where the confusion lives, the quiet confusion so many people carry. The test said everything is fine, but the legs say otherwise. If you have been dealing with this for longer than you should, there is a complete program that works this venous return system in depth, combining a physical protocol, postural adjustments, and sleep strategies across a documented 21-day plan. The link is in the description and in the pinned comment right below this video. If you are watching on your phone, the QR code is on the screen right now. Just point your camera at it and you can access it directly. Now look at what happens over the course of an ordinary day. Pay attention, because this cycle is going to make you recognize something you may have already observed in your own body without understanding why. In the morning, the legs are fine. The ankles are their normal size. During the night, lying down, without gravity pulling fluids downward, the liquid that accumulated the previous day redistributes through the body. The tissues rest. The swelling subsides. But then the day begins. If you spend the first few hours sitting, whether at breakfast or watching television, the calf muscle pump sits idle. No contractions, no upward push. Blood starts slowing down in the leg veins. Pressure builds slowly. After lunch, if you go back to the armchair or the couch, the process deepens. The afternoon passes. The veins accumulate pressure. Fluid begins leaking into the tissues. The ankles begin to swell. By the end of the day, the shoes feel tight. The socks leave deep marks. The legs feel heavy, as if carrying an invisible weight. When you press with your thumb, the mark stays for several seconds. Then you lie down, and something interesting happens. With the legs horizontal, gravity stops pulling fluids downward. The accumulated liquid slowly redistributes. It enters the venous circulation, reaches the heart. The kidneys filter that extra volume. And that is why you wake up 2-3 times a night to urinate. It is not necessarily that the bladder has weakened. It is the fluid that spent the entire day pooled in your legs, finally reaching the central circulation the moment you lie down. And the kidneys responding to that increased volume with accelerated urine production during the first hours of the night. This cycle repeats every day, with variations depending on how much you moved, how long you sat, the days you stayed still the longest, the long car rides, the entire afternoons in the armchair. Those are the days the swelling is most intense, the nighttime trips most frequent, the sleep most fragmented. There is a man named Richard, 72 years old, a retired engineer, who lived exactly this cycle for years without understanding what was happening. A perfect echocardiogram, normal kidney function, well-controlled blood pressure. But his ankles swelled every single evening without fail. He had stopped wearing dress shoes because he could no longer get them on after 4 in the afternoon. He had stopped planning trips because he dreaded spending hours on a plane and arriving with his legs in terrible shape. And he woke up almost every night between 2 and 4 in the morning, went to the bathroom, tried to fall back asleep, woke again. The cardiologist looked at the tests and said the heart was fine. The general practitioner prescribed a mild diuretic that helped a little, but the swelling came back as soon as he stopped taking it. And Richard carried in the back of his mind a fear he never quite put into words. Maybe it was the heart after all, and the test just had not found it yet. The turning point came in an unlikely way. His family convinced him to take a short trip to a historic town. One of those places where you walk all day through cobblestone streets, up stairways, through museums. Richard went reluctantly. He was certain his legs would suffer. The opposite happened. By the end of the first day of intense walking, his ankles were nearly normal. He slept through the night, waking only once. On the second day, more walking, the same result. He came home confused, but with an observation he could not ignore. Movement had done what the diuretic had never managed to do in any lasting way. That contrast led him to understand the calf muscle pump, to realize that the problem was not his heart failing, but the leg pump stopping work during the long hours of sitting. You have watched this far. That says something about you. You are probably someone who has spent years hearing that your tests are normal, without a clear explanation of what is actually happening in your legs. Every day that passes without understanding the mechanism is another day of accumulated swelling, interrupted sleep, shoes that no longer fit. The complete venous circulation program is available now, with a 21-day protocol that goes well beyond what this video can cover. You decide. Either you continue as you are, or you access the link in the description and the pinned comment. The QR code is still on the screen if you prefer to use your phone camera. The choice is yours. Before we go into the protocol, there is something important to address clearly. Leg swelling can have several causes, and some of them require careful medical evaluation. If the swelling appeared suddenly, is in only one leg, and comes with pain, redness, or warmth, those are signs that need urgent investigation because they can indicate a blood clot. If the swelling came along with shortness of breath, intense fatigue, or abdominal swelling, you need to see a doctor immediately. What we are discussing here is the chronic, progressive, bilateral edema that builds throughout the day and eases with overnight rest, and that coexists with normal heart tests. If you recognize yourself in that pattern, what follows can make a real difference in your daily life. The protocol has 5 steps and takes about 7 minutes distributed across the day. Each step has a specific physiological function, and understanding the reason behind each one will make the practice far more conscious and effective. The first step happens before you even get out of bed. Before putting your feet on the floor, do 60 seconds of rapid calf contractions. Flex your foot toward you and then point it away, as if you are pedaling in the air. Do this rhythmically, without excessive force. By activating the muscle pump before standing, you prepare the venous system for the transition from horizontal to vertical, reducing the immediate impact of gravity on the leg veins. The second step is a 3-minute stationary march after dinner. Simply walk in place, right where you are, alternating feet. It may seem too simple to matter, but the timing is strategic. After a meal, blood flow redirects toward the digestive system, and peripheral circulation in the legs naturally slows. If you go straight to the couch after eating, that slowdown extends into the final hours before sleep, intensifying the fluid accumulation that will reach the kidneys during the night. 3 minutes of marching interrupt that pattern. The third step is the gravitational discharge position. Lie down and place your legs over 1 or 2 stacked pillows so that your knees are slightly bent and your ankles are higher than your hips. Hold that position for 2 to 3 minutes. Unlike placing straight legs up against a wall, this slightly bent knee position is more comfortable for older adults, especially those with any knee discomfort, and still creates the gravitational angle needed to support passive venous return. The fourth step is negative pressure breathing. Still in the discharge position, take a slow deep breath in through the nose, letting the abdomen expand fully, then a long exhale through the mouth. Repeat for 30 to 40 seconds. Diaphragmatic breathing creates pressure variations in the chest that assist central venous return. Each deep breath creates a gentle suction effect that helps blood travel upward toward the heart. The fifth step combines the previous ones. With the legs still elevated, do slow rhythmic calf contractions, flexing and extending the feet in a controlled manner for about 90 seconds. Here you are using gravity and the muscle pump simultaneously, creating maximum venous return efficiency with minimum physical effort. 7 minutes total, spread across 3 moments in the day. Before getting up, after dinner, before sleep. What Richard began to notice in the first week was subtle, but real. The sock marks that had been deep at the end of the day became less pronounced. The dress shoes he had set aside because he could no longer wear them in the afternoon started fitting again more often. Sleep did not improve overnight, but the bathroom trips in the early morning began to spread out. From 4 to 2, from 2 to 1. On some nights, none. These changes are the kind of result that sounds small when described, but represents an enormous difference in daily quality of life. Being able to wear your own shoes, sleeping without constant interruptions, not having to calculate whether you will have time to sit down during an outing to offset the swelling that is coming later. If this content made sense to you, leave a like, subscribe to the channel so you do not miss the next videos, and tell me in the comments, do you also experience this pattern of swollen legs by the end of the day with heart tests that show nothing? I want to know if this resonates with your experience. There is something genuinely reassuring about finally understanding what is happening. Not because understanding fixes everything immediately, but because it restores logic to what previously felt arbitrary and inevitable. The body swelling every day for no apparent reason creates a quiet anxiety. The feeling that something is wrong, and nobody can say what. That maybe it is just age, and therefore there is not much to be done. But when you understand that there is a specific mechanism, a return system that has been losing efficiency gradually for reasons that make physiological sense, something shifts internally. The problem stops feeling like a sentence and starts feeling like territory that can be influenced. Richard's heart was fine. The heart of most people who go through this pattern is fine. What was asking for attention was the leg pump, that structure that works silently all your life and that, with progressive sedentary behavior, begins losing its ability to push blood back upward. When the leg pump starts working again, even partially, even with the help of a simple and deliberate protocol, the whole body feels the difference. The tissues retain less fluid. Sleep fragmented by bathroom trips begins to reconstitute. The feeling of heaviness in the legs by the end of the day decreases, and with it, the constant quiet worry that something more serious might be happening that nobody is finding. Maybe your ankles are not trying to warn you that your heart is failing. Maybe they are trying to tell you that your legs have stopped pushing blood back home, and that is a message you can start responding to today, with 7 minutes, before you even get out of bed tomorrow morning. If you know someone over 60 who deals with this same pattern of swelling at the end of the day, and tests that explain nothing, share this video with that person right now. No introduction needed, just send it. Because sometimes the right information arrives before the right appointment does, and that makes all the difference. Subscribe to the channel. The next video will pick up right where we left off, going deeper into other silent mechanisms that affect the body after 60, and that are rarely explained with the clarity you deserve. You are the kind of person who does not accept vague answers about your own body, and this channel exists exactly for that person.